What I experienced with Miguel was that it was actually my love that he was most afraid of. And so the more that I tried to connect with him, the more he would react and go into his reactivity, his guarding. He was very aggressive at the time, physically aggressive. That's how it came out for him. Other children that I've worked with, they tend to just shut down and isolate. And so what I learned was that love is what feels unsafe for them. And I had just assumed that since that's what they needed, since that's what they hadn't had, then they would welcome that. And that's not always true. And what I had to figure out then was how to create the safety for him where then he could take the medicine, which was my love. The love is the medicine, but if their mouths are closed tight, like you can't force the medicine down their throat. And so I had to actually learn that love does not feel safe to someone who has experienced danger within those relationships that we're supposed to provide love. And so the place where we have to start is actually creating that safety that's not associated with the love itself so that they feel safe enough to start to connect and open up and then love. And there's this whole progression, and Dr. Steve Porges talks about this, and we can apply it to these children who've experienced this form of relationship trauma, and that love is actually the last thing that happens. What needs to happen first is trust, and trust comes out of predictability. And so now that I understand these principles of the nervous system, I see everything that I did wrong, everything that I started off wrong, and am able to teach that this is what we need to do in order to create the safety to then be able to open up for the love, which is what will transform them.